Hi, my name is Dr. Mark Halpern, and welcome back to my series of short videos on chiropractic care. Today I want to answer the question, is chiropractic safe for children? My kids who are here with me today, and I'm going to show you how I adjust them, have been adjusted literally since the day that they were born. The fact is, kids are easier to treat, you have to use less force, and their bodies adjust much easier and are much more flexible than adults. And if you can prevent subluxations and imbalances in the spine from starting when they were small, they're going to be much healthier when they grow older. And teaching them how to keep their bodies healthy is really important. Just like most 4 or 5-year-olds know to see a dentist from a very young age, it's important to let your kids know spinal health is important. So what I'd like to do is take you through an adjustment of my daughter so you can see what that's like. She's 5 right now, and then we're going to do an adjustment of my 2-year-old son. Okay. So here is Jessica, and what we're doing is checking out her leg length so you can see if there's any imbalances. And right here you're going to see the left leg is shorter than the right. Jessica, can you turn your head to the right? Good job. Okay, and you can see, relax. Good. So now the heels are even. So what we do is we go up and we check. And there is an area there that is not moving. So look straight down. And what we're going to do is use drop pieces, which are very gentle, so that there's very little twisting on the head. So it comes up, and we contact it, and we go straight down. And then we come back and recheck the heels, which are still short on the left. So now what we're going to do is adjust the pelvis. So what I do is I contact here, and just like with the neck, we're using drop pieces to make it very gentle. And of course, if the mom is in the room, we're going to want to explain everything as we're going. And you can see now we have perfectly even heels, which means there's balance coming down from the spine, which is our purpose all the time. Now I'd like to just show you how we do the same thing with a 2-year-old. Thank you, Jessica. Andrew, come over here, baby. Okay, come here. Andrew's turn. Okay. And now, the same thing with my little boy, who also has a short left leg. And then for little ones, we just turn their heads. Good job, Andrew.
Wow.
Okay, and that's still short. And now look the other way. Good job, buddy. Okay, and that one corrects it. So just like we did with Jessica. Up, look straight, honey. Look straight. No, right. Look straight down, baby. There we go. Okay. And we come up, and we got our palpation right in there, and that's it.
Hello, do you hear me?
Okay, and let's...
Your voice doesn't take pain.
Okay. And we're going to do the same thing with Andrew's pelvis. Okay, and now we have 2 balanced children. Of course, there is more to it in taking a history with the parents and understanding what is going through the whole body, but I hope that gives you a good idea of what an adjustment is all about and how safe and gentle it can be. If you have any questions about this or anything else, visit me at my website, www.thetorontochiropractor.com. Thanks, and I'll see you next time.